Welcome to This Week in Health IT. It's Newsday. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Special thanks to Sirius Healthcare, Health Lyrics, and Worldwide Technology, who are our Newsday show sponsors, for investing in our mission to develop the next generation of health IT leaders. We set a goal for our show, and one of those goals for this year is to grow our YouTube followers. We have about 600 plus followers today on our YouTube channel. Why, you might ask? Because not only do we produce this show in video format, but we also produce 4 short video clips from each show that we do. If you subscribe, you'll be notified when they go live. We produce those clips just for you, the busy health IT professional. So go ahead and check that out. We also launched Today in Health IT, a weekday daily show that is on todayinhealthit.com. We look at one story each day and try to keep it to about 10 minutes or less, so it's really digestible. This is a great way for you to stay current. It's a great way for your team to stay current. In fact, if I were a CIO today, I would have all my staff listening to Today in Health IT so we could discuss it. Agree with the content, disagree with the content. It is still a great way to get the conversation started, so check that out as well. Common question I get is, how do we determine who comes on This Week in Health IT? To be honest, it started organically. It was just me inviting my peer network. And after each show, I'd ask them, is there anyone else I should talk to? And then the group, obviously, the network grew larger and larger. And it helped us to expand our community of thought leaders and practitioners who could just share their wisdom and expertise with the community. But another way is that we receive emails from you saying, hey, cover this topic, have this person on the show. And we really appreciate those submissions as well. You can go ahead and shoot an email to hello@thisweekinhealthit.com. It will go to the entire team. We'll take a look at it, reach out to these people, and see if there's a good fit to bring their knowledge and wisdom to the community as well. Now, on to today's show. All right, today we have a lot of topics to cover, and not that many stories, but a lot of topics. And so I welcome Ann Weiler. Ann, welcome back to the show.
Hello. Sorry, just about to take a sip of coffee as you're welcoming me. Thank you.
Sorry, it was a short welcome. Yeah.
I thought you were going to intro more topics.
It's interesting. Each one of the guests that I have, recurring guests I have back on the Newsday show, has a different perspective. And your perspective is one where I like to go in a lot of different directions. Your perspective is as a former founder for a health tech startup, and you sold that startup. And there's just a lot of stuff going on these days. I mean, Transparent and those guys have come forward, and that's exciting. You have a story, several stories that you're going to share, which I think lead us into a different direction. And I have one story. It's kind of odd. I don't usually do this, but I read the annual report from JP Morgan Chase, and this is where I'd love to start, because it had so many good things in here from the founder, founder of JP Morgan would be JP Morgan, but Jamie Dimon, the CEO, he had a lot of good stuff to say, and I think it gives us a lot of different topics we can jump off on. Did you have a chance to read this?
I skimmed it. I was actually kind of hoping that you would.
Oh, that's great. You know why that's great? Because I skimmed the articles that you sent me.
The audience hasn't read it either. So you can talk to me like I'm the audience.
I know. So and actually what this shows is we are two extremely busy people. I skimmed your articles and I thought, well, I hope you're going to lead me through them. I'm going to lead you through this one a little bit. So, Jamie Dimon is one of those people, when he talks, the world listens. He's one of maybe 2 or 3 annual reports that I read every year. Obviously his and Berkshire Hathaway and actually 2 or 3 others. This one was interesting. It was longer than most. He touched on a couple of healthcare topics. He touches on Haven. He touches on remote work. He touches on the competitive threats that are now facing banks from Fintech and from other startups and digital companies. And it's really interesting because he makes the statement in there that it's full-on competition now, that they have matured, that their technology in some cases is better. It gives a better experience all around for banking or lending than even JP Morgan with their size and scale can give. And when I was reading some of these things, I thought, that's an interesting perspective. CEO JP Morgan saying, look, they're not nipping at our heels anymore. They're actually stepping into our backyards and they are actually making an impact. Do you think we're going to start, or are we already starting to see that in healthcare? Or do you think that dynamic is going to play out in healthcare?
I hope it does. I got into healthcare because I saw inefficiencies and things that could be so much better for patients. And well, I don't know if we've had this conversation before, but I tend to, and I'm not saying this to brag because it's actually not a brag. I tend to see things like, 10 to 15 years before they happen. And I go, this is going to happen. And I get all excited. And then it's like, well, yeah, but wait. Yes, it will happen, but wait. And that's how, with healthcare, it will happen, but I still think it's going to be a while. And then to me, like, the infrastructure costs are so high and the tech stays around so long. So if you think of the infrastructure to build a hospital and how long you have all of the tech that's in that hospital, and think about, I was reading an article again yesterday about IoT, and I was thinking so much about all those devices in hospitals that are either connected or disconnected and potentially security risks, and things stick around so long that I think it's going to be a while. It's still going to be a while. And, we were also seeing hospitals, they've been on this innovation bandwagon, and we can talk about innovation as, some people talk about innovation theater and it's just to try and look innovative. But I think that the first wave of innovation was, oh my gosh, there's all this stuff happening with the initial digital health. And it was innovation theater. And now, though, they were questioning the ROI of that and actually looking at how do we do different things? How do we partner with different types of organizations? So the pressure's there, the change is coming, and I think we'll end up in more of a hybrid. That's my prediction, but it's going to be a long time.
Yeah.
There was I didn't give you this one, but there was a Forbes article on Epic yesterday that I was reading, and it was just reminding me just how big they are and how many hospitals they run and how that's not going anywhere quickly.
No, it's not going anywhere quickly. And that's one of the things that sort of, having been in the CIO chair and having looked at it, the amount of money we spend on the EHR and the maintenance of the EHR and the time we spend on the EHR is huge. And now a lot of people would be listening to this and saying, well, of course it is, Bill. It's the most important system we have. It runs so much of the hospital. I'm like, yeah, but no other industry does that. No other industry spends that portion of their IT budget and their staffing and their time on maintaining a system like that. It's almost serving the system rather than really focused on, what it can do for the community or the patient or the efficiency. And so we're just constantly feeding that animal. But I don't really want to go down that path too much. I agree. What's that?
I said me neither. I had another thought.
What's that?
This was a thought I had a little while ago, which is that there's a change that has to happen at all levels, but doctors are actually all trained in the system. Like, they're trained in hospital systems. And you meet doctors, especially younger doctors. I mean, it's terrible. I shouldn't say that. It's not. You meet doctors of all ages who believe that things should change, but they're trained a certain way. And so they're coming into the system, being trained by the system that they're going to work in, which is different than I think any other industry. You're trained, you may be trained at a university, but then you go out in the world and the business is very different than, you learn the theory at the university, not the practice. But doctors are actually raised in that system. And so they have to be part of the change. And some of them will be because they see, things that aren't working, and some won't because that was the path that they went through. So I think that's another tricky thing in shifting healthcare, is that you cannot have healthcare without doctors. I mean, we have all these examples of, like, yes, you can have practitioners with different levels, but that's almost like it's a I don't know what to say, like a path or a pipe that is kind of reinforcing some of the ways that things are done.
But isn't that part of the point that the doctors are realigning? They're aligned. Some are aligning with tech startups. I see a lot of tech startups hiring doctors away.
Yeah.
Some building full teams. I see United Healthcare is actually, through Optum, just buying doctors' practices all over the place. And so they are realigning. And as that realignment happens, doesn't it? I think that will be one of the things that will sort of give us an indication that the change has taken hold and it's starting to pick up steam. When doctors are looking at when providers are trying to hire doctors and they can't get them because they've all gone to these alternative methods where they have a better quality of life potentially.
Yeah, yes, that you're right. That might tip the balance. It's just a question of, I don't know. You go talk to some of the doctors at the top teaching hospitals and whether they're really excited about joining a startup. And as a startup, we had a couple doctors come through on rotation, and they were incredible and they were unusual. And even with being incredible and unusual, there was the theory and the practice where, we would be designing these care plans and they'd be like, well, you have to do this. And we're like, you know what, if you do that, no one's going to use this care plan. Like, there's people at the end of this, and you have to understand what they are and aren't going to do. So, and those were, exceptional folks who sought us out, who said, I want to go see what's going on in a startup. And they both ended up in, well, one of them ended up in Kaiser. I'm trying to remember where the other one did, but but still, Kaiser's still a massive health system. So I don't know about the Optum example either, because I just saw something recently where some small, I don't say small, but anesthesiologist practice was suing Optum for something related to in the network, out of network pricing. So I don't know about how much doctors want to be owned by Optum either.
Yeah, I'm not saying that they do or want to, but I'm saying that when we see more doctors outside of the provider world lining with health tech, it'll be interesting. This story goes on. It talks about one of the things that the fintech companies have over the banks is they have a lower regulatory burden and they have a lower cost structure, and both of those things are an advantage going in to the new market. In fact, Jamie Dimon actually calls for a review of the regulatory environment that these people, the fintech companies, operate in, because it does create an unfair playing field. And you could see that as, of course, he's going to say that, or you could also look at it and say, well, there's a certain amount of truth to that. So it'll be interesting to see how the startup world plays out. He goes on to say a couple other interesting things. He said, we need to make the healthcare system work better. Better health drives both productivity and labor force participation. He spends a lot of time on labor force participation in this, especially around equities and those kind of things. We have the best healthcare in the world, and in terms of doctors, hospitals, and pharmaceutical and medical device companies, but we certainly do not have the best outcomes. As I discussed earlier, 30 million Americans do not have any insurance. Obesity, high blood pressure, asthma, diabetes, and other conditions are rampant, and costs are far too high. With little discussed earlier, 30 million Americans do not have any, with little transparency into their calculation. And that's something we talk about a lot, little transparency. We don't know what we're getting when we walk in that front door at a hospital. Annual medical costs per person in the United States are now $11,000 versus $4,000 in other developed nations. There are ways we can make significant improvements. Here are a few. Allow bigger incentives for becoming and staying healthy, eliminate bureaucracy and waste in the healthcare system, including administrative complexity and fraud, which is about 25% of healthcare costs, according to his findings. Empower employees to make better choices through more transparent employer plan pricing and options that include the actual cost of medical procedures, eliminate surprise bills, and a couple other things. He goes on to a couple other good things in this. And it's interesting. That's the perspective of a large employer who essentially is looking at this saying, look, my benefits meeting is contentious every year. We're raising the cost of delivering care. It's becoming harder and harder to give people what they want. given the options I have from the insurance carriers and whatnot, there aren't really good options. I'm hiring a younger crowd in metropolitan areas who want to stay healthy, and they want a different looking kind of plan. And we're not seeing that emerge yet. They want a plan where somebody is monitoring them 7 by 24 with the devices that they have put on their wrists and other things. They're willing to share that information, but very few doctors and health systems are willing to track that information and take responsibility for that information to say, hey, I'm tracking that information for you, and this is what it looks like. By the way, if you have a question, go ahead and text me. And then when you text them, they actually get back to you and say, hey, I'm recommending that you talk to a nutritionist, and a nutritionist is part of that. When we're talking about this upcoming group of people entering, there is a propensity to want to stay healthy, but the plans are still designed around sick care much more than they are around health and wellness. Even some of the corporate wellness programs are just okay with regard to that. A lot of interesting things. What have you seen with regard to the corporate world in terms of care and the expectations and the challenges that they're facing?
Yeah. I mean, there's so much in there, Bill. So much. It's an interesting thing. I would say certainly pandemic related. I've seen a lot of focus on mental health and mental health programs, which is great. And I think, that's kind of the start of it. Like that there's so much relation between your mental health and your physical health. Like if you are really stressed, that is affecting things. That also you might, that's when you don't eat well. That's when you might not exercise. So I think that's a really interesting place to start. When you were describing this, though, my first thought was, what's JP Morgan doing for the health of the employees? Because it's not about the health plan. I was thinking about this as, okay, I live in Seattle, and we all know what Seattle's like. People are outdoorsy and running all the time, but it is since the pandemic has started. Every time you go to the wilderness, there are so many people there because there's nothing else to do. And also because people have more time. They're not commuting to work. And so, I thought about this like lifestyle change it's not a complete change because we were already pretty healthy and active out here, but work has shifted to allow people to live more healthfully, and they're also eating at home. So they're not eating out as much. So I have this question around, it's one thing for the employers to say the health plans aren't giving us what we need, but what are the employers doing to start with to encourage a more active lifestyle for people? I was thinking back, years and years ago, when I used to work at Microsoft, we moved into a brand new building, and the building had gigantic stairwells. Like I can't describe, like they were as wide as a whole room, and they were painted with murals. And the whole point was, don't take the elevator. And it was a 5-story building, and most people took the stairs because the stairs were actually pleasant. And I have gotten myself into trouble so many times in office buildings where I tried to take the stairs, and then I'm like, getting spit out into a parking garage because all the doors are locked. So that's my first question. Like, what is the work environment doing to encourage people to be healthy and not, necessarily sitting in front of a computer all day, and more time to get out and even just, walking up the stairs in the building? And then the second is, this question around, do doctors really need all that data, especially if somebody is healthy? So, I kind of go back and forth on this, we need tech. From a tech standpoint, we need to make sense of the data. We can't just be, I remember, when I first started in digital health and Fitbits were all hot, and people, especially in Seattle, because we're all fit, were walking into their doctor's office going, here's all my Fitbit data. And the doctor's like, that's nice. Like, what do I do with this data? And I think that's where the things become interesting is, what are your goals? And what are the anomalies in this data, or what can we learn from this data? Not just like, here's all this data you're tracking 24/7, and then what? And then, going back to my previous point, like medical schools aren't training doctors to do wellness care. So there's a whole bunch of stuff that has to shift. And then there's this question of like, I've seen the data as well about do wellness plans and employers work? So there's so many components. And I do agree that the offerings, first of all, when you're choosing a health plan, like you can't even tell. Like you just want to be able to say, this is me and this is what's important. And there's no plan that enables you to do that. So that might be the first step. That would be really interesting. And certainly employers can drive that. But I've never, I'm work at Amazon now. I've worked at Microsoft. I've never had an experience where someone has asked me what I need in a health plan. That might be the first step. Maybe they're overbuying because they're not actually asking. Some people only want catastrophic, right?
Right. It's interesting. I'm going to violently agree with you on the first one. I mean, that's such a great point. We can stand there and say, this doesn't work and health systems aren't providing this, payers aren't providing this and whatnot. But you could just do a tour of the facilities that these organizations have and say, all right, what have you done for your employees? And you could do just a brief survey of the employees to talk about, the work-life balance and those kind of things, and just determine, are they creating an environment where people can be well? That is an excellent point, and I'm glad you made it. The second one is, and you sort of came around to it. At first, what I heard you saying is, the people would walk in with their Fitbit data and the doctor would say, yeah, what do you want me to do with this? And the point being, we've never asked the consumer what they want. And I tell a bunch of different stories around this, and I'll spare the audience because I've told some of them several times. But there were several times in my CIO career where we got pretty far down into a project and finally said, hey, what do the patients want? And when we finally asked that question, we realized, hey, we just wasted 6 months because we didn't take the time to understand what people want. And, as an employee of a major organization, or just an employee as an employer, I'm an employer now. What I want is, I want a plan that is going to take that information and have somebody monitor it. And it doesn't have to be a doctor. I don't expect it to be a doctor. I just expect it to be somebody who is trained medically, who can look at it and say, yeah, there's no anomalies. Now, we can talk about what needs to be done on the back end, AI, machine learning, those kind of things. So we just don't dump a bunch of data in front of that clinician. But I do want that. I want to offer that to my employees, because I think my employees are saying, I got this device because I want to be healthy. And that's the first indication. Yes, it's a fashion statement, and yes, it's cool to have the fill in the blank watch or cool thing, or track your steps and track your hiking and different workouts and that kind of stuff. But at the end of the day, what that's saying to me is, I want to be healthy. All right, let's design the plan that works for the employer. Let's design the plan that works for the employee, where they're at and where they're trying to engage us. And yes, you have to offer all the other things around sick care and those kind of things. I also don't want to be locked in to the health system that's down the street from me. I can get on an airplane. I can go somewhere else, and I want to go somewhere else. If I live in a place where the health system down the street doesn't make the U.S. News and World Report rankings, and I want to go to somewhere where they do make those rankings, I want to go to an academic medical center that's really going to provide a certain level of care around cardiac or cancer. I want to be able to do that as well. So I want more options than what I'm currently seeing. And by the way, I just signed up yesterday for my company's, what we're going to offer to our employees. And I'm just telling you, it's just weak at best.
Yeah. I also, it's funny, many hats. I also was an employer with a health plan. And that's another interesting thing. Like, we had, well, first of all, we needed help. We needed a broker to help us figure out, what the heck do we offer to employees? But it was very interesting to monitor it as well, because I have very healthy employees with almost no claims. And I didn't do, it was nothing. I don't say it was nothing to do with me. We did actually put the office in a place where most of the people, we had one person who drove. And everybody else, well, no, that's not true. We had 2 people who drove, but everybody else walked or biked for most of the time. And so, and we made that decision when we were, moving to a permanent office from a co-working space of where should we be so that people can be, having a nice commute and be healthy and all of those things. So that was an interesting thing to watch, that, our premiums actually stayed flat or went down because we had this healthy workforce. So, it's a very, very small model, but I think the employer can have a lot to do with it in facilitating and listening to the employees about what they want.
Yeah, it's interesting as you're talking about that. I'm scanning this, and it's like a 60-page report, that annual report that they put out for JP Morgan. He talks about work from home, and here's some of the things he said. Generally speaking, we envision a model that will find many employees working in a location full time. That would include nearly all the employees in our retail branch locations, as well as jobs in check processing, vaults, lock boxes, sales, and trading, official operation functions, and facilities, amenities, security, medical staff, and many others. Some employees will be working under a hybrid model, some days per week in a location, et cetera. And a small percentage of employees, maybe 10%, will possibly be working full-time from home for very specific roles. He goes on to talk about the virtual world also presented some serious weaknesses. For example, he has 4 weaknesses that are presented, at least for JP Morgan. Performing jobs remotely is more successful when people know one another and already have a large body of existing work to do. It does not work as well when people don't know one another. Second thing was, most professionals learn their job through an apprenticeship model, which is almost impossible to replicate in a Zoom world. And I'm really curious what your thoughts, because you've worked in these models. A heavy reliance on Zoom meetings actually slows down decision making because there's little immediate follow-up. And the fourth thing is, remote work virtually eliminates spontaneous learning and creativity because they don't run into people at the coffee machine, talk with clients, et cetera. So he notes that there's those 4 challenges. And it sounds like, for the most part, he's saying a majority of their workforce is going back to the office.
Yeah, that's a hot topic these days. I am fully remote right now, joined the company fully remote. I'm doing work right now that I know how to do. And I think that, I don't know the company, but if I didn't know exactly what I was doing, I think it could be really challenging, especially that apprenticeship model. I think that was a good call out. At the same time, commutes are one of those things that really hurt people's health, people who have long driving commutes in particular. And so, I've seen since pandemic, people talking about they miss their commute because it was this break between office and work, but that they would actually be like going for a walk during their commute. Like they get up, go for a walk, come back, start working, to sort of, mimic that commute. So I think there's also this there's a difference of energy that you get when you see somebody in person. We're missing a lot of the nonverbal cues. You're having a meeting, you can't see everybody's face at once. You don't know who's not bought into what you're, trying to decide on. So I think a hybrid model is going to be possibly the best. I think this going into the office all day, every day, there's a lot of quiet thinking work that is very hard to do in an office. So, but I don't know, it's gonna be interesting.
Yeah, I'll agree with you. The last 2 points he makes, and then I want to hear about your story. So while we disbanded Haven, we will continue to build on what we learned. What did we learn from them disbanding Haven, do you think? Do you have to be careful to answer this one?
No, I mean, I would say be careful. I was always puzzled. This is my main point with Haven. I was puzzled about how you could be a CEO of a startup, a full-time doctor, professor at Harvard, and a correspondent for a magazine, a top magazine. That was my query, was like, each one of those seems like a full-time job.
Yeah.
That's my only comment about Haven.
Yeah. Speaking of Atul Gawande's Yeah, it didn't seem like he got all into the boat. It seemed like he was doing a lot of other things.
Like my takeaway from that was like, oh, it's not very hard to be a doctor or a professor at Harvard because you can also run a startup at the same time.
and be active on social media and publishing articles and stuff. Yeah, I mean, I've talked about that a bunch, and I think we're going to continue to see innovation, mostly from Amazon because they're the most innovative company of those three. Just in the way that innovation will need to happen in healthcare. I don't think we're going to see Berkshire and JP Morgan Chase do a lot of innovating. They'll invest in innovation in healthcare, but not much in the way. But we'll keep an eye on Amazon Care and other things. The last point he makes is cyber risk remains one of the most significant threats to our economy, and I think that's really true. And I had a meeting yesterday with a client, and we were talking about cybersecurity, and they were sort of pushing on me a little bit and saying, why don't the CIOs see how much of a threat this is? And my pushback was, they absolutely see how big of a threat it is. I mean, for the first time in our history, we saw entire hospitals shut down. We saw medical images just go up in smoke, essentially, and health systems had to start over with 0 images and 0 information in their EHR and try to rebuild from scratch. So this has definitely caught the attention of CIO. The thing that's interesting to me is I think it's caught the attention of CEOs across the country, and I think it's caught the interest of our federal government and other agencies. It'll be interesting to see how we progress here. I think we're going to see a lot more public-private partnerships around this. I think we're going to see a lot more meetings like I've seen within healthcare, where you essentially have the FBI coming in and briefing CIOs for healthcare organizations. This is a serious threat to our economy. It's a serious threat to healthcare. This is the first time healthcare has been targeted as an industry. That's really interesting. So that's the last throw-out point. I want to hear your story. You have some interesting stuff here.
Yeah. So I sent you 3 stories on similar topics, talking about health tech for women, particularly, middle-aged women. And then one was an opinion piece from a doctor that was about data. And after I sent you these 3 articles, I realized that they were reminding me a bit of a book that I wanted to recommend. And I know I come on here, it's supposed to be news. I'm always recommending books. But there's this book that I read.
I think our listeners read books as well.
Do they read books? Well, I recommend that they read a book called Invisible Women, Data Bias in a World Designed for Men. Especially in healthcare, because there's a couple chapters on healthcare, and particularly the health implications of not having the right data. And I think for anybody who's a CIO should be really thinking about the data that they have. And that's what sort of got me thinking about it, was the one article, the opinion piece from the doctor, who was saying, how basically some of what we're saying is, people are not paying any attention to women's health. So let's just start with that. There's a New York Times article that says the title is Femtech the next big thing in healthcare? Now let's replace that with man tech. Is man tech the next big thing in healthcare? And you can see how ridiculous a question that is. Yeah. So we're talking about, technology that might be geared to the health issues of 51% of the population. And yet, in 2019, it received $592 million in venture capital investment, which, on the one hand, if you don't know much about venture, that seems like a lot. On the other hand, we have companies that do, I don't know what, just marketing tools. I don't have a good example right now, but these companies valued at $1 billion, individual companies, right. And less than $1 billion was put into all of this technology. So that's one sort of piece of it. And so there's this idea of like, this is actually a business opportunity. It's also a healthcare need, and that this article is talking about how women aren't represented in medical research. There was concerns about whether women could be pregnant, and so they're not represented in medical research. And then there's just like the all of the systems. If you think about the EHR and you think about the kinds of questions that get asked, like things that are just not even appropriate. I've had my mom filling out a form, being asked if, is there any chance she's pregnant? Well, like, come on. Like, so the data is incorrect, and there's not enough of it, is one of the challenges. And then I started to question, like these apps are coming up because of this issue of like, there's nothing tailored towards different, stages of a woman's life, whether that's, the fertility side of it, which was the first area that's really started to see this traction. And then I think in the last 3 days, I've seen a number of companies focused on menopause, which is another one where in this opinion piece, the doctor is saying, I asked a bunch of residents whether they had any patients in menopause, and they all said no. And it's like, that's not actually possible given the demographics of the patients that you're caring for.
Sheer numbers does not support your statement.
Sheer numbers do not support your statement. So the point I wanted to make was, well, first of all, there's still this sort of condescending, like, is this an opportunity? Yes, it's an opportunity. But I think it's an opportunity not just for technology that is specifically aimed at, women's health, but it's an opportunity for the EHRs, for example, to think about like, how are we collecting data on women's health? It's absolutely an opportunity for clinical trials to make sure that they are representing a diverse population. So there's also, there are other diversity issues in clinical trials as well. But it did sort of take me back to this book, which I think when you read this book, or if you read this book, you would see the answer to these questions is yes. Like, we're missing a ton of data that could improve health. It could improve all kinds of products. And so, one of the things I was remembering from the book was, crash test dummies were tested on the average male, and medical textbooks were based on the average male. And so it's like, we could be doing so like low-hanging fruit from so much of a better job of both collecting the data and caring for diverse populations. So
it's interesting. And I have a hard stop in 2 minutes. So I apologize for this. I really wish I had given this more time, because I agree with you. I will pick up the book. I'll read the book. I'd like to get more educated on that. But I will say from the investment side, how investments work, right? There has to be an economic model on the other side of it. And prior to Livongo, there really wasn't anything for diabetes because it was hard to build the financial model based on the weird incentives that exist within healthcare. And I think that's where the question of, is Femtech the next thing? Can we build the financial models to support, the large and diverse population that is women with startups? It'll be interesting to see.
Yeah, it will be. I think that they're right now filling a niche, or I want to say niche because it's not a niche, but they're filling a gap that the larger players are not looking at. So there's always an opportunity when someone's ignoring something, and then eventually, hopefully it should become, more integrated.
Yep, absolutely. And thank you for your time. We had trouble scheduling this week. That's why we have a shortened session, and I apologize for that. We're both running around a lot. So thanks for your time. I appreciate it, and look forward to the next time we get together.
Sounds good. Good to see you.
Take care. What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.